Hi, my name is Eugene Stolo, and I'm a second-year internal medicine resident at UT Health San Antonio. I first want to acknowledge my terrific team from UT Health San Antonio who helped make this project possible. Their names are listed at the top of this poster. So acute biliary pancreatitis is one of the leading gastrointestinal causes of hospitalization in the United States. Mortality due to biliary pancreatitis ranges from 3% in patients with interstitial edematous pancreatitis to 17% in those who develop pancreatic necrosis, demonstrating the need for early diagnosis. The CT Severity Index is a reliable predictor of outcomes in acute biliary pancreatitis, as it takes into account both pancreatic inflammation and necrosis. Disparities in health outcomes are known to exist amongst different ethnic groups, but little has been studied regarding differences in severity of biliary pancreatitis, particularly in Hispanics. So that was the aim of this project, was to compare the severity of disease in Hispanics versus non-Hispanics based on the CTSI, the CT Severity Index, of initial CT imaging findings in the revised Atlantic classification for acute pancreatitis. This was a retrospective analysis of 303 patients, 185 of whom were Hispanic, aged 18 to 80 years, who presented with biliary pancreatitis at a single tertiary care academic hospital from 2012 to 2019. Abdominal CT studies were reviewed by a single radiologist, and the CTSI and Atlantic classification were documented. Some CT scan examples are seen in figures 1 and 2 on the poster. Our study findings were quite interesting, and you can read those in table 2. Notably, 4 out of 5 patients who presented with a pancreatic pseudocyst were Hispanic, and the average CTSI score was higher, 2.14 plus or minus 1.96 for non-Hispanics, putting them in the moderate severity range, and 1.82 plus or minus 1.76 for Hispanics, putting them in the mild severity range. Though our study did not find a statistically significant difference in severity amongst ethnic groups, the average CTSI score, as well as the percentage of fluid collections, were higher in non-Hispanic patients. However, the higher prevalence of pseudocysts in Hispanics suggests a delay in presentation, leading to a greater disease severity. Biliary pancreatitis is an evolving clinical entity, and more research must be done to elucidate differences in clinical severity and outcomes amongst these different ethnicities. Thank you very much.